What organism is most likely to cause difficulty swallowing and belching in a 40-year-old immigrant from Peru who has a dilated esophagus and absent peristalsis in the smooth muscle portion of the esophagus? Now, this patient is presenting with symptoms of achalasia secondary to Chagas disease, and Chagas disease is caused by the parasite Trypanosoma cruzi. So the answer to this question is going to be answer choice D. Now let's go over the pathophysiology. Remember, our autonomic nervous system is divided into three parts: the sympathetic nervous system, the parasympathetic nervous system, and the enteric nervous system. Now, the enteric nervous system is going to be made up of collection of neurons that are going to be divided, or they're going to be collected into the submucosal plexus as well as the myenteric plexus. Now, submucosal plexus is going to be found within the small and the large intestine, whereas myenteric plexus is going to be found from the esophagus all the way to the rectum. Submucosal plexus is responsible for blood flow. Here, as you can see from the submucosa, there's some blood vessels, whereas myenteric plexus is going to be responsible for smooth muscle contraction. And you can know this by the MI, which means muscle. Now, this parasite is going to cause damage to the myenteric plexus as well as the submucosal plexus. So I'm writing MP for myenteric plexus. The function of myenteric plexus in the lower esophageal sphincter is to relax it. So normally the lower esophageal sphincter is contracting, and we need the myenteric plexus to relax it so that food can travel from the esophagus to the stomach. So if we have damage to the myenteric plexus, that means you're not going to have this inhibition of the lower esophageal muscle or the sphincter. So the lower esophageal sphincter is going to keep on contracting, and this is going to narrow. And this narrowing is not going to allow for food to travel from the esophagus to the stomach. So we're going to have accumulation of food within the esophagus, and then this can cause a large esophagus. Now, this can also happen within the rectum, causing megacolon. So the myenteric plexus is also responsible for smooth muscle contraction within the colon, and it is also responsible for relaxing the rectum so that stool can flow out. But if we don't have that relaxation by the myenteric plexus, then there's going to be narrowing within the rectum. So then we're going to have accumulation of stool within the colon, and that can result in megacolon. So here's a summary slide. This parasite is going to be found most commonly in Central and South America. It is caused by the protozoan Trypanosoma cruzi, and it can also have cardiac manifestations because this parasite can infiltrate the heart and it can damage the heart muscle, causing dilated cardiomyopathy. And we talked about some of the GI manifestations like megacolon and megaesophagus secondary to the achalasia. And on histology, we're going to see dark nuclei, as you can see from this picture.